Hello everyone, my name is JDRhone, and I will be presenting an article review on the effectiveness of manual therapy versus surgery on self-reported function, cervical range of motion, and pinch grip force in carpal tunnel syndrome. So carpal tunnel syndrome, or CTS, has an incidence rate of 1.8 per 1,000, prevalence ranging from 6.3% to 11.7%, and it has a large economic burden. So CTS is a pain condition associated with repetitive movements and accounts for nearly half of all work-related injuries. So a person diagnosed with CTS is significantly more likely to miss more work days than an asymptomatic individual, resulting in a large economic burden for the individual and for society. And this costs the U.S., for example, nearly $2 billion annually. So the objective of the study, it was to compare effectiveness of manual therapy versus surgery. And it was comparing cervical range of motion, pinch grip strength, symptom severity, self-reported function. And then they had a second objective, which was to try and determine if changes in cervical range of motion or pinch grip strength were associated with changes in self-reported function. And then the hypothesis was women receiving manual therapy would exhibit better outcomes in cervical range of motion, pinch grip strength, but similar outcomes in self-reported function than those receiving surgery. So the population that was chosen were women, mostly because they're 3 times more likely to have CTS than men. And then in the study, it was women who were diagnosed with CTS and who worked from home or in an office. And then the women of the study were selected consecutively according to their clinical findings and electrophysiological findings, and either worked from home or were secretaries who worked in an office. So here's kind of just a breakdown of the two groups, the manual therapy group and the surgery group. So you can see here the age was about 46 plus or minus 9 years for manual, and then for surgery it was 47 plus or minus 8. And then the years of pain, the occupation, so for manual, 20 worked at home, 30 were secretaries, and then 22 for surgery worked at home, and 28 were secretaries, so on and so forth. So the next slide here would be the type of study it was. It was a single-blind randomized clinical trial. So the reason why it was single-blind was mostly because the researchers were mostly blind to who was in what group. So a researcher who was not involved with the subject recruitment conducted the concealed allocation of the participants using a computer-generated randomized table of numbers. And then the clinicians who obtained follow-up information were also blinded. So the people that were aware of what group they were in were obviously the participants of the study. So the study sample size was calculated to be 39 per group. The researchers used the calculations to determine the sample size that was based on a pilot data to detect treatment differences. So they used 0.8 units on the main outcome, assumed a standard deviation of 1, and then they used a two-tailed test with an alpha level of 0.05. So they hypothesized that they would have a dropout rate of about 15%, and the desired power beta of 90% was required, and they came out with a total of 50 patients per group, so 50 for the manual therapy and 50 for the surgical group. All right, so here is kind of just like a breakdown of each group and who was lost. So like 1 month follow-up, both groups had 58 participants. 3-month follow-up, both groups had 50. At the 6-month mark, the manual group lost 1. Because they had surgery in the hand. For the 6 month for surgery, still have 50, and then at the end, both groups lost a total of 3 each. So the inclusion criteria for the study: participants had to have pain and paresthesia in the median nerve distribution, a positive Tinel sign, and a positive Fallon sign, and then exclusion. What excluded somebody from participating in the group was they had to have exhibited sensory motor deficits in the ulnar or radial nerves. They had to be, if they were older than 65 years of age, undergone previous hand surgery, received corticosteroid injections or any other type of steroid injections. Multiple diagnoses of the upper extremity trauma, systemic underlying medical diseases causing CTS, such as diabetes or thyroid disease, comorbid musculoskeletal medical conditions such as rheumatoid arthritis or fibromyalgia, if they were pregnant or if they were a male. So statistical analysis. So they used SPSS version 20.0, which is a statistics program that assists users' accessibility with advanced analytics through improved tools, output, and ease of use of features. The Kolmogorov-Smirnov test, which is used to determine if a sample comes from a population within a specific distribution. Standardized mean differences is also known as the Cohen's d. So it's used to report efficacy and continuous measurements, especially for scores on a pain intensity rating scale. And then a linear regression analysis. So on to the results. So here, there was only a couple scenarios where manual therapy showed a significant difference or statistically significant difference compared to the surgical group. So patients receiving manual therapy exhibited a statistically greater increase in self-reported function at 1 month than those receiving surgery. So a mean change of negative 0.08 with a confidence interval of negative 1.1 to negative 0.5. So here on the first graph here, you can see at the 1 month mark, there was a significant difference of pain or self-reported function in their hand that was affecting them with the CTS. And then the between group effect size was large, so the standard mean difference was 1.6, and then changes in self-reported function were similar in both groups at 3, 6, and 12-month follow-ups. So the only difference was that 1 month mark between the two groups. Although you can see in the second graph here, the manual therapy group had a little bit of a bigger difference, but it wasn't statistically significant to, report that it was better than surgery. And then here's kind of just a breakdown of all the statistics for the function of the pinch tip grip force outcomes within a group and between group. And then it continues on here. So patients who received manual therapy exhibited higher increases in their pinch tip grip force on the symptomatic hand at 1 month. Again, so on the top graph here, A and B, you see the manual group both had significant, statistically significant differences compared to the surgical group at 1 month. But between group effect size was large as well, with a standard mean difference of 1.1. But the changes in pinch tip grip force on the symptomatic hand were again similar at the 3, 6, and 12-month follow-up marks. And then here again, it just shows the cervical range of motion for between and within groups. So the results found that no significant changes were observed in the cervical range of motion in both groups for any motion, whether it was flexion, extension, lateral flexion towards the most symptomatic side, rotation towards the most symptomatic side, or rotation away from the most symptomatic side. So range of motion, no matter where they went, it was the same for both groups, whether they did the manual therapy or went through surgery. So they concluded manual therapy and surgery have similar outcomes. However, the manual therapy exhibited significant clinical improvements at 1 month, and then no changes in the cervical range of motion for either group. And then similar outcomes in self-reported function and pinch tip grip force at long-term follow-up periods as well. So the biggest difference was just at 1 month with slight differences, but that were not statistically significant to report, but manual therapy still showed a better progress through short-term, especially short-term, but as well as long-term. So the biases observed, the results were all agreeable, I believe. Biases observed was the researchers recognized the potential bias of the study as only women from a single hospital were included in the study, and then also the effectiveness of manual therapy should not be applied to men, just because no men were in the study. And then considerations, a larger study can potentially yield better results in the future. And then the study design according to the text, randomized clinical trials are the gold standard for identifying the right therapy and what effects of the treatment are. So this was the perfect study design to use. They just need to possibly make some better tweaks in the future. And that concludes, and here are my references. Thank you, and hope you all have a great day.